Things are going very well, actually, in Washington. I've actually visited the Washington Health Benefits Exchange a couple of times just to check it out, and the website responds beautifully. It's very easy to navigate, and I think the last numbers I saw of the states that are running exchanges, Washington has over 25,000 people who have already enrolled and signed up for insurance since October 1st.
Are we ahead of the pack?
We are ahead of the pack.
I'm not surprised because we're the coolest state.
Well,
so
absolutely.
That would make sense that we would be in front. So we're trying to shift from episodic care, going into the emergency room, to taking advantage of preventive care, which is now mandated to be covered with health insurance.
Absolutely.
How is that all going to work?
Well, the fact of the matter is that for decades in the United States, we have not had a health care system. We've had a sick care system. We respond beautifully when you have illnesses or injuries, and we do great in those circumstances. But we don't prevent what we can prevent. We know very much how to do early detection of disease so that we can prevent it from becoming chronic and severe. And there's a lot of preventative efforts that we need to take to avoid disease in the future. The fact of the matter is that about 5% of the population consumes about 50% of the cost of healthcare in this country. And those people have chronic illnesses, they have multiple diseases, a lifetime of bad diet, sedentary activity level, diabetes, heart disease. If we can avoid that, or detect it early and take steps early to the point where people can live a longer, healthier life, the savings are immense.
Yes. In fact, I read just recently, tell me if this is right, that more than 50% of chronic diseases are lifestyle related.
Absolutely. And we've been exporting those lifestyles around the world.
Yes, that is true. Okay. So will we be seeing a more collaborative approach to healthcare if we're looking at prevention?
Absolutely. Both patients and physicians are going to see a big difference in how they approach healthcare. In the past, it was one patient, one doctor, decide on a plan, affect that plan together. Well, that's very inefficient, and we can't manage huge populations that way.
Right.
So we're going to need nurse care specialists, we're going to need physician assistants, nurse practitioners, medical assistants, health coaches, nutrition coaches, dietitians. There's going to be a team around people's health care. And so patients will experience something very different. They'll have, somebody described it as an entourage for your health. A bunch of people focusing on what's right for you and what you need when you need it.
Will that make it easier to get your questions answered? Because I know doctors don't have a ton of time, and you don't want to call about every little thing, but if you did have a healthcare coach, there would be somebody you could contact.
And there have been a number of systems that have tried this, and they've actually hired college graduates that don't necessarily have a healthcare background to be those health navigators. And whereas somebody will say, well, I've got a question, but I don't want to bother Dr. Yatman with that, I'll call Frank. Frank's my buddy. Frank can get the answer for me.
Exactly.
So it's a very effective model.
I would be one of those people because I always feel like the doctor's terribly busy, and I'm pretty sure this isn't any big deal, but that's how you get in trouble, right? So we're not just talking about preventive care, but also management once you have some sort of condition or disease that you need to deal with. How will that change?
So a couple of the very key parts of the Affordable Care Act were the mandated coverage of preventative services and screening services with zero deductible and zero copay. That's huge.
It is huge.
I remember, I practiced OBGYN for about 30 years. I remember trying to convince women to get mammography when it was an $80 charge. Well, that was a barrier for a lot of women. Now it is a preventative screening test that should be covered 100% under the Affordable Care Act. So we are removing barriers to those screening. Getting early detection is really the key. My mom's a breast cancer survivor. She was detected early. She's now 12 years out from her disease. And that is a story that's repeated again and again and again when you get early detection.